Thank you for joining us today, Natalie. Can we just start by asking you how the coronavirus has impacted Sunrise Senior Living and Gracewell in terms of infections and fatalities?
Well, I think like all care home operators, the biggest impact that the virus has had on us has been the fact that our homes have been all closed and nobody apart from very essential visitors has been able to come in. I think that looking at the coverage that's been in the media, I think that we've done pretty well, unfortunately, compared to some others. We've had some infections, but because all of our homes are single room en suite, we've had no shortage of PPE. We've had full availability of PPE all the way through. In actual fact, the number of infections we've had has been relatively low. And when we look at our death rates, 2020 January to early May compared to prior years, they're up a bit, but nothing like I think some other operators unfortunately experienced, which we're pleased about. We'd slightly higher death rates in Gracewell. Our typical length of stay there of residents is shorter, and there are many more nursing residents, and they are inherently frailer. We've also seen a decline in other causes of death rate and in other risks areas. So we've had much fewer falls over the past few weeks, much less home-acquired pressure damage. And we attribute that to the fact that we have been looking after our residents significantly in isolation where there have been symptoms, and therefore people simply haven't been venturing out and having the opportunity to unintentionally fall over and then end up in hospital. So it's quite a complicated picture that we see in terms of the number of people who've been affected, our death rates, but also the fact that we're not seeing people dying from other things that they might have done in normal years.
That's interesting. Thanks for that, Natalie. We've seen in the national figures a decline in fatalities from COVID-19 related symptoms. Are you seeing that trend in your homes in terms of
Yes. So we now regard the vast majority of our homes as being open, as it were. Yes, the infection rate, I think, sort of peaked early to mid-April and then has declined. And we've had, quite a number of homes that haven't had anything all the way through, which is fantastic. Sometimes related to their geography. Obviously, some parts of the country have been affected more than others, and sometimes I think they are advantaged in terms of the design and so on of the buildings, and obviously the very rigorous use of PPE, and that's helped protect people.
So you're saying in the current situation, the majority of your homes are not affected, or?
Yes, the vast majority. I think about 36. We have 46 homes, and about 36 of them we would say are completely clear. And then there's a handful of them where we've just got the tail end of infections. What we are seeing, which I think other operators are seeing as well, is that as the testing program all too slowly rolls out, that we are finding that both residents and team members who've been completely well are unexpectedly testing positive. We're not clear about the infectivity of such people, but we are treating them always as if they are infectious, and the team member goes home and the resident is obviously looked after in isolation. So we've taken a really low, our low tolerance in terms of, high levels of protection, significant use of PPE in order to try and prevent entry of infection and then to prevent lateral spread. And we've done really well in preventing lateral spread where we have had an outbreak of infection.
That's great. And in terms of the occupancy levels, how have they been affected?
Well, occupancy's dropped, not just because of unfortunately the residents who've died, but also because we haven't been bringing in new residents. So I think that we brought in Sunrise in April about an eighth of the number of residents that we expected. And in Gracewell, we brought in less than a third of the number of residents that we had planned for in that month. We decided not to admit new residents, unknown residents as it were, from the outset, from hospital, for example, without a test, a test having been undertaken. And we haven't been bringing in people from home as well. So actually our challenge in occupancy is less about the fact that unfortunately some of our residents have died from the virus, more from the fact that we have been not bringing in new residents. And our challenge now, as the infection currently dies away, and hopefully we don't have a second wave, or that remains possible, our big challenge is how we refill our communities and homes over the next few months. And that's going to be a bigger challenge than we would like, because perhaps unintentionally, there's now a strong perception in the general population that care homes are not safe places to be because they are rife with COVID. So we're going to have to work, as our other operators and with Care England, on changing that perception.
Yeah, that's interesting. How you intend to go about changing that perception?
Well, we've got a good story to tell in terms of our actual experience and the facts, and but it's also about providing reassurance to all the sorts of questions that people will have, and those are around access to PPE, people being isolated, testing, and also fears. A big fear, I think, in people is that if an outbreak happens again, if my mum or dad moves in and then the home is closed, I won't be able to visit. And it's an absolutely legitimate fear. So that's why we have to be so rigorous in controlling outbreaks and being able to really give confidence that the chance of that happening, should somebody move in, is as low as we can make it. But we can't give, obviously, 100% guarantees. And we just have to, talk about the positive things, all the normal things in life that have and are carrying on, and the standard and the stringency of the measures that we're taking to protect our residents, to protect our team members, to those who are looking for a care home place.
And and then going back to the admissions issue, is that going to be something that will be an increasing problem going forward, or?
Well, we don't know. I think that everybody is now working on what it is that needs to be done to rebuild confidence. I mean, clearly, if somebody is, perhaps somebody who's got progressing dementia, has struggled at home, there may be very little choice for some families. Their mum or their dad or grandmother really does need to go into a care home. But not everybody who goes into a care home was in those circumstances. A lot of people, it's a more planned decision, houses, family household, and so on. And I think people like that are going to be thinking twice. And also quite a number of old people are actually staying with their family at the moment. They're staying with their children. And so it's not as urgent. So there are all these things that need to be taken into account. And we just need to be, keep working at it, doing the very best that we can, keeping our homes safe. And gradually, I think sentiment will turn around. I think that, there's an awful lot of old people who've been by themselves for a long number of weeks now, and many of whom must be extremely lonely. And being with other people is so important. So I am hopeful that it's something that we and others, both individually and then through Care England, through a common campaign, we will be able to address, and we'll see things improving over the next few months.
Yeah. How significant impact financially will this admissions issue be for you?
Well, I think like everybody, our revenues have taken a hit, and our profitability this year. And in addition, not only have we had the costs of substantial amount of PPE, but we also invested a lot in our people and our team members. We uplifted statutory sick pay. We increased our hourly rate by more than 20%, which is still in place. We put in enhanced overtime. We hired a fleet of 7-seaters, so all our team members could be transported to and from work. We're giving all our team members free meals when they're working. We did everything we can to recognise, the fortitude of our people coming to work and being, like in the NHS, the backbone of the country, helping to look after the most vulnerable citizens. And also, we wanted to make sure that team members who themselves weren't well actually did stay at home, and didn't because maybe other people at home or out of work or whatever, then come to work and potentially putting their colleagues and residents at risk. So we've also invested a lot in that. But we believed that it was the right thing to do. We didn't want to be using agency labour and unintentionally agency workers, going around from one home to another and bringing in the virus. So we have invested a lot in protecting our residents and so on through the virus. And the answer is we have to fill up our homes again. I think everybody recognises this is a truly exceptional set of circumstances, and we have only been able to do what we have done because of our team members. So we're not going to be taking costs out and taking out roles and all that sort of thing of the very people who have stood up for us over the past weeks. We see the way out of this as rebuilding confidence in the sector and gradually refilling our homes. And we're fortunate that we've got a very supportive board, and we've got very supportive owners who invest in us and who have supported the approach that we've taken and remain supportive.
Is fee levels an area you'll need to look into in order to offset this lack of new admissions? Or?
No, I mean, I think obviously everybody has followed and implemented the CMA's guidance on consumer protection. We have been clear about what our annual increases will not be more than, which was 5.5%. Our uplifts for this year have all gone in. We will look with the rest of the sector, I think, at towards the end of the year. But obviously, we have the ability to move away from that in exceptional circumstances. But at the same time, general inflation at the moment is 0.8%. So, we have to recognise that we're struggling, but many of the people who are paying the fees for our residents will themselves be in difficult circumstances. Many of them may be furloughed, they may be losing their jobs, family homes may not have been able to be sold. So we have to be very thoughtful and not take knee-jerk decisions that actually have unintended longer-term consequences. We want people to stay with us and recognise the challenges that everybody is under, and in looking at the solutions about rebuilding and coming out of this.
And just looking at staffing levels, how much have they been affected during this period?
Well, less than we thought. So I think that, talking to other providers, during the outbreak, we were anticipating that we might have had shortages of staff up to 25% at times. And we really haven't seen that. We were thinking we'd have to do an awful lot of recruitment of short-term bank workers and so on. Actually, probably about 10 to 11% is the sort of average we've had off at any one time. A little bit more at the beginning when people were not quite clear, the rules around shielding and who was vulnerable and that sort of thing, risk assessments of pregnant employees and so on, all of that. So it was higher at the beginning, but it's then settled down, and now it's largely recovered with most people back at work.
And how have you gone about combating that sort of lack of staff at times?
Well, people have pulled together. We've had more overtime being done, a little agency, but as I said, we've tried to keep away from that. I mean, people have been, amazing. They've absolutely pulled the stops out to keep everything going and looking after residents. And that's what we have relied on. Of course, that means that people are tired now. And so we're ensuring that people are taking leave by the end of June. We've set expectations for everybody across the company to have taken at least a week's leave. And we're making sure that we're paying attention to how people are feeling, surveying our employees in terms of their sense of well-being and pressure, and making sure that we're supporting people as much as we can in tangible and softer ways.